Hi again. I'm going to divert from my meditation videos to a new one. And this one, because we're having a pandemic of COVID, I thought I would talk a little bit on COVID. So, in the beginning, I'm going to do a disclaimer that this particular video is accurate as far as medicine is concerned as of 5 p.m. today, but may not be accurate tomorrow or day after, as new information is always gathered. So let me start by saying that the coronavirus as such is not anything new, but this particular one, which is COVID-19, is a new one. This is an RNA virus, and it originated in China. And there are apparently two varieties of them. One is called L, the other one is called S. We really truly don't know if there is more significance to the two varieties. 70% in China was L, 30% was S. As I mentioned, it is an RNA virus, and it is something similar to SARS, severe acute respiratory syndrome, that we had seen in the past. And it also has the same receptor affinity called ACE2, angiotensin converting enzyme 2 receptors on the cells. As you know, the viruses can't live outside the cell for a longer time. This ACE2 inhibitors medications are used in medicines for control of blood pressure and also for congestive heart failure. That's the reason I mentioned it. However, it has no difference, or holding this medication that people may be on does not benefit or is not needed, or at least not recommended at this time. So the virus cannot stay outside, but it is spread by the coughing and sneezing, which can go as far as 6 feet, and that's the reason 6 feet distance is recommended. It stays in the droplets, and experimental labs have shown that it can survive in the droplets outside the human cells for at least 3 hours. The entry occurs through a mucosa, so eyes, nose, and mouth, and that's where the recommendation of not touching your eyes, not touching your mouth, not touching your nose comes in picture. The incubation period is 4 to 14 days, but average is 4.4 to 5 days only. And the majority of symptoms will occur within a week, though as much as 11 days have passed in 97% of the symptoms to occur. The symptoms are not high fever, which we have seen usually with viral infections, but the dry cough, the upper respiratory symptoms, and like congested nose, myalgias initially occur. Lack of appetite, low-grade fever also is known to occur. Average temperature in almost 40% of the patient was less than 100 degrees in China. Again, new information will be available. So if somebody has these symptoms and they have been exposed to somebody with COVID, certainly they need to be tested. The additional information that I can give you would be that the severity is mild, moderate, and severe. In Italian experiments, or experience rather, almost 49% of the people who died, there were 3 or more medical conditions that they were suffering before they had infection. 2 or more medical conditions existed in almost quarter of the patients. Only 0.8, that is 0.8% people who died had no previous medical condition. Hypertension, diabetes, morely diabetes than hypertension, underlying chronic kidney disease, underlying immunosuppression, cancers, or even pulmonary diseases. People were more prone to getting this as a severe form. Again, the transmission can be either mild, moderate, or severe based on the host and the agent. So if somebody has a mild infection, and he doesn't even know or she doesn't know, then the transmission is likely to be less to another healthy person, or if it occurs, the disease is likely to be less. However, if the infection is severe, like somebody is admitted to ICU, and somebody who is visiting is also an immune compromised or elderly patient, then they can get it more quickly and can get a severe disease. The mortality in, say, for example, in South Korea was only 0.9%. As of today, when I calculated it, the death mortality or death or the mortality in US is about 1.2%. When somebody is admitted to ICU, that jumps to about 5.5% because they have severe pneumonia. The females seem to be less affected than the males, not know why, but certainly that seems to be a fact. Couple of other things that I can say is that almost 81% of the people had a majority of the patients had a mild infection or asymptomatic, and severe infection occurred in about 5% of the patients. So even though it is a bad virus, fortunately it is not killing people as high as everybody is worried about at this time. I'm going to briefly talk about treatment, and the treatment is, of course, supportive care, which means if needed an oxygen. The use of non-steroidal anti-inflammatory. There was a big thing about it. Some anecdotal cases in younger patients, when they were given non-steroidal anti-inflammatory, which means ibuprofen, Advil, those kind of things, Aleve, those kind of patients got severe disease. We don't know if there is a correlation. It has not been proved. So, however, taking that into account, best thing is to take Tylenol for the muscle aches and fever. Second is steroids. Unless somebody is on a maintenance dose of steroid for other reasons, steroids are detrimental because, again, steroids are also severely anti-inflammatory, and that seems to cause problems with the virus getting more severe infection. The isolation should be taken place for at least 5 days after the symptoms have appeared. Some people say preferably 7 days, and of course 14 days is what is recommended right now by everybody, including CDC and World Health Organization. Please note that regular mask, if you're wearing, it will not protect you. N95 mask will protect you. The better thing would be for patients or suspected patients to wear the regular mask, and the person who is seeing them or is in contact with them maybe wear gloves. Definitely not touch the eyes, nose or mouth, and wash hands with soap and water. 60-70% alcohol is also very effective, but soap is easily available than any other anti-infectants or alcohol containing creams or foam that they standardly use in the hospital. The treatment, there are 2 or 3 different treatments. The medications I would not even try to mention here. Those are experimental studies that have been going on. But there has been a big thing written about chloroquine, which was used for malaria, and which is chloroquine phosphate, and another one called hydroxychloroquine or Plaquenil in US. The Plaquenil was used, or is still used, for rheumatoid arthritis and certain anti-inflammatory uses, but commonly used for rheumatoid arthritis. A study of 36 patients, which was published, showed that when 200 milligrams 3 times a day was given for 10 days, within 6 days, people who were given this drug, hydroxychloroquine or Plaquenil, became negative on their smears from the nose or nasopharynx, compared to the people that were not given continued to share the virus. So it looks like from this data that it is effective. I think my thinking is that by April 1st, because we have done a lot of isolation, a lot of more testing, a lot of more awareness in the general public, we should be in position to improve. I was going to talk a second thing, which is the astrological positions of planets and why we are having this, or why somebody astrologically knowledgeable could say why we are having it. But in this particular video, I don't have enough time. Only briefly that I can mention is there is a variety of planets which are crowded in sign of Capricorn in zodiac, and bunch of them are going to move out or change, including sun, which is different. Sun is in Pisces now. And this, I think, will turn around the corner for the world. But I'll talk about that maybe in next video. Thank you for watching. Have a nice day.